Now, after this tamheed or the preamble or the gate patterns, we go to definitive clinical examination. What we have to do, and you know most of these examination methodology while doing the other patients examination, but little bit variation. And so hip abduction test is the assess abduction of the hip joints, right? And you usually, it should be done in extension. When you do an extension, there is a combined temperature of here is the 45 degree. Now you have to differentiate between this temperature, whether this temperature is because of this gracilis muscle or because of the adductor muscle. And this can only be done when you neutralize the gracilis, and gracilis can be neutralized while you are flexing. So in this extended position, when you flex the hip joint, the temperature from the 45 degree input to the 70 degree, it means there was a temperature in the gracilis which did not allow further movement. But if it is further flexion, if allows 100% extension of the abduction, it means that it was because of the gracilis temperature which was. But if it does not improve in any way, then it is a structure. And this must be assessed, because sometimes the adduction is so much that it continues to have an internal rotation as well. So this test is called usually the Phelps test. Well, assessing the gracilis. You extend, you find 45 degree temperature. When you flex and abduct, it is normal. It means this temperature disappear because of the flexion of the hip and flexion of the particularly knee joints. So if this muscle was crossing over the knee joint, so it was in temperature, it allows flexion, allows the abduction when there is a flexion of the knee joints, which is the positive Phelps test, the gracilis temperature.